Media manager of Asia for Save the Children International. He joins me now from London. So great to have you on the program. Can you explain to us the conditions such as population density in Cox's Bazar and how big the danger is of a full-blown outbreak?
Yes, so the Rohingya refugee camps are actually some of the densest on Earth, approximately 40,000 people per square kilometer. Now, just to give you an example, New York City, the densest city in all of the US, has around 10,000 people per square kilometer. So the camps are 4 times more dense than New York City. This means any attempts at social distancing or self-isolation will be extremely difficult. Add to that the sort of poor hygiene and sanitation in many parts of the camps, with access to clean water and hand washing facilities so scarce. So yes, we think the potential for a large outbreak is very real. But I'd also like to just say it's not just the camps. You know, Bangladesh as a whole is really going to struggle to cope with a full-blown outbreak. This is a country of 160 million people and only 2,000 ventilators. And in the camps themselves, there are no ventilators whatsoever.
So how does Cox's Bazar differ from other camps around the world? Or is this a crisis that's just waiting to happen in all of them?
So, as I said, Cox's Bazar is the most dense refugee camp in the world and certainly the largest in terms of population. So it does face unique risks from coronavirus. But all refugee and displacement camps all over the world are perfect breeding grounds for COVID-19 because they all have certain similar characteristics. For example, the physical proximity of camp residents, the lack of hygiene facilities, and often weaker immune systems due to inadequate food supply. And this is particularly relevant for children. So to be honest, up until now, the virus has really been spreading in urban areas right around the world, from Europe to the US and even in Asia. We just don't know how the virus is going to behave in a refugee camp setting and what effect that will have.
And you talked about how social distancing isn't a possibility given the density there. So aside from finding a way for them to go home safely, which isn't a realistic option, what can actually be done?
Well, yes, of course. I mean, the solution to the plight of the Rohingyas is for them to return to Myanmar in a safe and dignified manner, and that's what the international community should be working towards. But right now, in the short term, we are working. Save the Children is working with the World Health Organization to set up a number of isolation and treatment beds right across the camps. We're also raising awareness in the community on how people can protect themselves and stay safe. But the task before us is immense. Johns Hopkins Center for Humanitarian Health, an institution in the US, predicted that in the event of a full-blown outbreak in the Rohingya camps, we would need approximately 10,000 beds. Now, at the moment, aid agencies and the government of Bangladesh really only have capacity for 1,500 beds. So the world really needs to come forward and help Bangladesh through this crisis.
Okay, we're going to leave it there. Bhanu Bhatnagar from Save the Children International. Thank you so much.